Hello friends, welcome to my YouTube channel Study Mind with Dr. Roy. Today we are going to study another topic. So let's start the video. So today's topic is surgical wounds. So what are surgical wounds? Wounds caused due to surgical procedures. Means during surgical procedures, the wounds that are created are called surgical wounds. So classification. Classification is based on two things. One is risk of infection, other one is degree of contamination. So we can see here classification based on risk of infection and degree of contamination. Now there are four classes in which surgical wound is categorized: class 1, 2, 3 and 4. Class 1 includes clean wounds. Class 2 includes clean contaminated wounds. Class 3 will include contaminated wound. And class 4 dirty wound. We have mnemonic to memorize this, like we know CCD, that's the brand name, Cafe Coffee Day. So just similar to that, we have another mnemonic CCD, triple CD. Okay, so first one is for clean wound, second one is clean contaminated, then contaminated, and then dirty. Clean, clean contaminated, contaminated and dirty. Now first category, clean wounds. So what is clean wound? So in clean wounds there will be no inflammation, and if the technique used for that wound will be sterile technique, means there is no infection associated with it. And wound is primarily closed wound, means that the wound is in general nature is closed type. Aerodigestive, genitourinary and biliary tract are not entered, means the systems like digestive system, urinary system or biliary tract, we don't go to that level. So it is simple clean wound. Now infection rate is lesser, 1 to 5%. Examples of simple wound include thyroidectomy, mastectomy, a lipoma excision. We can memorize lipoma excision as one example of clean wound. Second category, clean contaminated wound. So in the second category after clean wound is clean contaminated wound. As the name indicates, there is some contamination here. So since there is no inflammation as such, but infection is present, like minor break in the sterile technique. The technique we have followed is not complete sterility is maintained in this technique. There is minor break in the sterility technique. Okay. Now the digestive or genitourinary tract is entered, but there is no spillage as such. Okay, there is no spillage, but these tracts are entered. Infection rate is more than the previous one. Earlier it was 1 to 5%. Okay, here it is 8 to 10%. Example of clean contaminated wound is cholecystectomy and simple appendectomy. Cholecystectomy and simple appendectomy are the example of clean contaminated wound. One simple way to memorize the example is, see, you can see one C here and one C here, like cholecystectomy, so clean contaminated wound. Okay. Now contaminated wound. Contaminated wound are the traumatic wounds, and hence inflammation will be present here. Since there is trauma, so there will be the inflammation triad will present, that we have seen in the previous video. Major break in the sterile technique, since it is sterile technique is not complete and there is a major break in the sterile technique. Gross spillage and contamination will be found from the all the tracts like GI, biliary, respiratory, genitourinary tracts. Infection rate is higher, 15 to 21%, 15 to 20%. Example of these wounds will include traumatic wounds and cholecystectomy with bile leak. Earlier, if it is will be cholecystectomy, then it is clean contaminated wound. But if cholecystectomy is with bile leak, it will come under contaminated wound. Okay. Now the last, dirty infected wound. Dirty infected wound, since the name indicates, there is much infection than the previous category. So the organism present at surgical site prior to procedure existing infection, means before the we proceed for surgery, infection was there. So this will cause pus formation. Okay. Perforation might occur. GI, biliary and nodal tracts that we have studied, perforation might be seen. Infection rate is more. Example, appendiceal abscess or peritonitis. These are dirty or infected wounds. So again, we have seen 4 categories in this video. The topic was surgical wounds, and classification we have studied. What is the basis of the classification, risk of infection and degree of contamination, and 4 classes of surgical wounds like Cafficophidae, pneumonic triple CD, clean, contaminated and dirty wound. Clean wound we have studied. Example was lipoma excision. Clean contaminated wound we have studied. The rate is more, and the example was CC like cholecystectomy. And contaminated wound we have studied like traumatic wound. Gross spillage will be there and rate is higher, and example is cholecystectomy with bile leak. And dirty infected wound, organism present at the priorly before surgery, pus will formation will be there, infection rate is more, and peritonitis or appendiceal abscess. These are the examples. So with this, we conclude this video. Thank you friends for watching the video. Do like, share and subscribe with your friends, and follow the channel for the more such content. Thank you so much.